Good morning. I'm Dr. Lisa Richardson, Director of CDC's Division of Cancer Prevention and Control. I want to thank the planners of the meeting for having me come today to represent public health on this panel. I have no disclosures. I'm often asked to define health equity in the context of cancer prevention and control. And the answer is simple. Our vision is that all people are free of cancer. We must address inequities within cancer prevention and control to do this. Equity is achieved when every person has an equal opportunity to prevent cancer, find it early, get treatment, and live longer, regardless of race, ethnicity, income, age, gender, sexual orientation, disability, or geographic location. Factors such as our race, ethnicity, and socioeconomic status should not play a role in how healthy we are or how long we live. Unfortunately, for many of us, it does. The social, economic, and environmental conditions around us, the air we breathe, the water we drink, our education, and our income are all part of the broader context in which we live that determines our ability to live a healthy life. These social determinants of health lead to stark and persistent health disparities in the United States. President Biden's executive order set the stage for government to work on these issues. He has challenged every governmental agency to develop a plan to address racism as a cause of poor health outcomes in the United States. CDC brought issues of social justice and health equity to the forefront of the national discussion by declaring earlier this year that racism is a public health threat. The CDC director charged agency leaders to find new ways to strengthen and expand health equity efforts to address racial and ethnic disparities and the social, economic, and environmental factors that contribute to poor health. Most importantly, baking these concepts and actions into our everyday work. The 10 essentials of public health were updated last year to include equity at the center of what we do. Previously, it had been research. These are not new challenges for public health or the cancer control and prevention community. I'm here to talk about what CDC is doing to improve health equity for cancer prevention and control, and what you can do individually and collectively. This is not easy, but we need to be bold and we need to act. Now is the time to determine a bold course of action to address structural and systematic changes that cause, systematic issues that cause health disparities. Most importantly, and what I'm challenging us to do today, is that we must address racism as the fundamental driver of health inequities, including inequities in cancer control. Over generations, racism has led to clear health disparities within a racial and ethnic populations, as we see magnified today. At CDC, we administer evidence-based screening programs for breast, cervical, and colorectal cancers. We've shifted our focus to working in health systems to make systematic change that does not rely upon the individual healthcare provider to make decisions about who gets screened. For example, Black women and white women in the United States have breast cancer develop at a similar rate, but death rates are almost 40% higher for Black women. To address these disparities in breast and cervical cancer mortality, Congress passed the Breast and Cervical Cancer Mortality Act in 1990, which authorized the creation of the National Breast and Cervical Cancer Early Detection Program. Through 70 funded programs today, CDC helps women with low incomes who are uninsured, underinsured to gain access to timely breast and cervical cancer screening, diagnostic, and treatment services. The program also provides patient navigation services to help women overcome barriers and get timely access to quality care. But what most of us don't realize is that cancer screening is not just a test, it's a process. That means not only helping to provide access to cancer screening tests for all eligible adults, but making sure that people get timely follow-up care and treatment when needed. This is one of the cornerstones of the National Breast and Cervical Cancer Early Detection Program. Over the last 30 years, the program has served nearly 6 million women and provided more than 15 million mammograms and Pap tests to women in racial, ethnic, and rural communities disproportionately burdened by cancer. But still, we see disparities. Here we see our other large program that we administer is our colorectal cancer control program. And we know that 90% of early 90% of cancers can be found early and they can be treated effectively. So we are working to support widespread adoption of evidence-based interventions to increase colorectal cancer screening. In this graphic, you see that over the last period of our program, which ended last June of 2020, as more evidence-based interventions are implemented in clinics, cancer screening rate for colon cancer increases. So we've shown that the community guide recommendations do actually work. During the pandemic, the cancer screenings dropped precipitously. For just these 3 cancers, the backlog of missed screenings is over 9 million. My concern is that those who are already impacted by lack of access to care will go to the back of the line, worsening disparities that we see today and before the pandemic started. So finally, who you are, where you live, and what your income is should not be a risk factor for cancer or have an impact on what options are available to you to fight cancer and live a healthy life. Making meaningful change will take all of us. Together, we can eliminate the harmful consequences of these preventable disparities. We couldn't do any of this work at CDC without all of you, our partners at the national, state, and local levels. We've made a lot of progress, but as you know, there's still a lot of work to be done. There's still too many people who are suffering and dying from cancers that could have been prevented or detected early. I appreciate your time this morning, and I look forward to hearing and learning about your bold ideas and working together to achieve health equity in cancer control. Thank you.